Good evening, Char Meegans here. Thank you for joining me. I'm an excellent developmental disabilities nurse with a passion to make a difference in the intellectual and developmental disabilities community by mentoring nurses, training caregivers and direct support professionals, supporting agencies, families, and the individual. So, one thing I have been talking to staff about today is that as staff and as caregivers, we need to learn to observe simple signs that make a difference in what we report to an individual's healthcare provider or mental health provider. And today, one of the things that we were discussing was learning how to look for edema. So you may think that that's kind of a silly topic, but actually, if you're supporting an individual that has, let's say, congestive heart failure, edema can be a sign of having heart issues because the blood flow is not getting through their whole body, and there's a fluid, settling in their feet and ankles because the blood is just not circulating properly. Thanks for joining me. And so today we had a customer that he's on a restricted fluid and salt intake diet, so it's important for staff to know how to check for edema. And the other signs to watch for would be a rapid weight gain over a couple days, or a rapid increase, maybe shortness of breath. So these are all signs that caregivers need to really learn to watch for so that they can report to their primary care physician right away. If you've got an individual that all of a sudden is having a hard time breathing, is very fatigued, with no energy, maybe a rapid pulse, high blood pressure, all of those things could indicate a heart condition or a heart attack. And so I guess that's why I'm coming on, because I just want, I assume too much. I assume too much with caregivers because we think that they've experienced life the same as us, and maybe they're a brand new caregiver and they've never been in the field of health and caring for someone else. And so we can't assume and take for granted everything. We need to be able to help train staff so they know what to look for. So if you're training anyone in healthcare, don't ever assume that they already know. Just, be gracious and say, you probably already know this, but I just want to let you know that edema can be a sign of some heart problems. And so how you check for edema is you go to their lower extremities, their legs, feet, and ankles, and you hold your thumb right on the top of the foot for 10 seconds and lift it. And during those, and then once you lift it, if there's a pit in the skin that is settling and it's rising slowly, if it's rising slowly, then that's pitting edema. And so I'm not saying you have to know how to measure it like a nurse, we don't expect that. But I would expect my caregivers to know that that is concerning. So there's a lot more to learn about that, but that's just a brief overview of simple ways and simple things to look for when someone has high blood pressure, heart disease, circulation issues. Those are things you can do as a caregiver to look for. All right. Thanks for joining me, and we will be talking again tomorrow. Bye.